You're listening to
and such a short amount of time to do it in.
a Mamamia podcast.
Hi, I'm Claire Murphy and welcome to Well. This is your full body health check. I've been a journalist for nearly 20 years, the past 6 of those hosting Mamamia's daily news podcast, The Quickie. So I have asked a lot of questions of a lot of experts about a lot of things related to women's health. But now I want to know more.
And my name's Dr. Mariam. I'm a Sydney-based GP and a staunch advocate for all things women's health. I'm also a twin mum to toddler boys, which is why I'm always tired. I'm so happy to be here.
Let us tell you why we're here. Well is about addressing the taboo, the annoying, the embarrassing, and sometimes the scary. We're going to cover concerns that you're probably considering seeing a doctor about, from insomnia to weird periods to how to prevent dementia. The difference is we're going to give you the tools that you need to make sure that you are seen and heard by your healthcare professionals, and we won't charge you once your 15 minutes is up. First up, we're going to take you to med school. This is where we're going to share something fascinating that we've learned in the process of making this podcast. Then it's into the checkup, where we'll explore a health topic in a stack more detail. We'll speak to a specialist too when we need their expertise. And then finally, it's the quick consult. We head off to the doctor's rooms where we solve a dilemma on any health topic as submitted by you. Today in the checkup, we're going to be putting a spotlight on periods, like can weight loss injections actually help with a particular menstrual issue? Why is period poo a thing? And when do you actually need to go and see a doctor? But first, we're hopping off to med school.
Welcome to med school.
So this is where I'm going to share something that I found out recently, which will equal parts freak you out and fascinate you. Have you heard about the sperm graveyard? Now, look, I came across this on my social media feed of a doctor in the US, which explained apparently the sperm that is ejaculated inside of you, obviously when your partner is not wearing a condom, and which does not end up fertilizing the egg, which is millions of them.
Mm-hmm.
Mariam, can you please explain to us where they go?
So when a man ejaculates, it's thought that 200 to 300 million sperm enter the vagina. That's a lot of sperm.
That's a lot.
And I like to think of the vagina as like the ultimate ninja warrior course, right? It's designed with lots of boogie traps to kind of kill the sperm before it gets to the egg.
Oh, so we're not welcoming it in
We're not
at all.
the vagina's not very welcoming. So there's things that the sperm has to get through, like the pH. So a lot of the acidity of the vagina will kill the sperm. There's the cervical mucus in which some of the sperm will get trapped in. And then the body identifies the sperm, and rightly so, as foreign invaders. So we'll send these white cells to kind of shoot them away. And then for the sperm that does make it through the fallopian tube, and at this stage, that's thought to be about 200. So you can imagine 200 to 300 million, and you've got 200 sperm remaining. The rest have just died from exhaustion because sperm is quite lazy.
That does not surprise me in the slightest.
So the sperm's traveling along. One, we hope, will fertilize the egg, and then the rest are thought to just keep swimming along. And so the fallopian tube's actually not attached to the ovary. So there's these like finger-like projections called the fimbriae. And so it can actually exit out of the fallopian tube into your abdominal cavity.
And this is what I've heard is referred to as the sperm graveyard.
That's right. So like if you have a visual, you can just imagine like this sperm just like falling into your abdominal cavity, but do not be alarmed. Enzymes break that sperm down and it's reabsorbed for nutrients for the body.
What happens after we absorb it? Like, are we using that for something?
Yeah, but if you think about it, sperm is like microscopic. You can't even see it. So like it's so tiny.
You know it's there.
Yeah, I know.
We are going to actually put that video of the sperm graveyard up on our socials too, so if you want to go and check it out. Later, in the section we are referring to as the quick consult, Elise asks us whether her vagina smells right. But next in the checkup, we're going to do some period myth busting, because even though we think we know everything about our menstrual cycle, trust me, we do not.
It's time for the checkup.
All right, let's get into it. Today, we are period myth busting. I've seen videos in my social media feed claiming that your period blood says something about your overall health. Like, is that true?
Not necessarily. Like, I'd call bullshit for some of it. So there's like variation in the color of your period through your menstruation cycle. At the start, it tends to be heavier, it's brighter because it hasn't had a chance to oxidize. And then as your period progresses, you've had some of that tissue sitting in there, it's reacted with the oxygen. You might pass clots and it might be darker brown or even close to a black color. The color variation, that's completely normal. But the signs that, would prompt you to see a doctor would be if it was like a gray or an orange tinge, that might suggest an underlying infection. A light pink might suggest iron deficiency. There's not really a strong link, but it might. And especially if that's something new for you or there's been a change, then that might warrant a doctor review. But no, I wouldn't say, your hormones fluctuate throughout the cycle. I wouldn't say it's indicative of estrogen or progesterone deficiency. There are a lot of hormonal health coaches online, unfortunately. So always check your sources. The only hormonal advice I would take from would be an endocrinologist, to be honest.
Yeah. So it's not like looking at your wee and going, oh, I'm dehydrated.
Yeah, no, it's no.
Okay.
Or your cervical mucus.
I'm not sure how comfortable I am checking out my cervical mucus, but maybe for the sake of this podcast, I might have to start. I also saw another post from someone who said they were a nutrition scientist, but they claim that taking vitamin D supplements can actually help with period pain. Is that true?
So there is some evidence that it can help period pain. Although in a lot of the trials, they were using really high doses, so well above the recommended range of normal. Vitamin D toxicity is very rare, but I would just advise anyone who wanted to take vitamin D, get your levels checked. If you're deficient, definitely start treatment, and always speak to your doctor before you're starting any supplementation. A lot of these medications can interact with other medications. And, some medications, if they're used outside of that recommended range, can cause toxicity. Although vitamin D is very rare in that regard, you should always speak to your pharmacist or doctor.
When should we be worried about our period?
What would not be normal is you've noticed a change in the pattern of your period. So it's starting to become more erratic, it's irregular, you're bleeding in between your periods, you're bleeding for a prolonged time, for more than 8 days, you're bleeding after sex, or there's significant pain with your period that's not being relieved with simple over-the-counter medications and it's disrupting your quality of life, or you're just concerned for any reason about your period, that's more than enough reason to see a doctor.
And as we know, 1 in 7 women in Australia are diagnosed with endometriosis, which often means heavy, painful periods. And that's something we'll be exploring and talking about in more detail in our next episode. How much blood is normal?
The average loss is thought to be about 30 to 40 mils, which is 6 to 8 teaspoonfuls.
Why are we measuring in teaspoonfuls? Can we not measure via menstrual cup or something? Like at least something we're using?
It's
like no one's poised over the loo with a teaspoon.
But we define heavy menstrual bleeding as any bleeding that impacts your quality of life in any way. So if you feel like, you're having to change your pads or tampon every hour, you're leaking through, your period's more than 8 days, you're passing large clots, which we say more than a 50-cent piece, then there's signs that something's happening. You should see a doctor.
Okay.
Yeah.
What are my options if I do have or I'm prone to having really heavy periods?
So if you do have heavy periods, I would really encourage you to speak to your doctor because there could be underlying causes contributing to the heavy periods. We also want to ensure that you don't have iron deficiency as a consequence of the heavy menstrual bleeding as well, which is awful. I get iron deficiency all the time.
Me too.
Yeah.
I feel like everyone I know now has an iron deficiency.
Yeah. And I always say iron supplements and iron infusions, they're kind of Band-Aid solutions. So you want to kind of address the root cause, and if that's heavy menstrual bleeding, then figuring out why you're having it and stopping it from happening is really important. So the first thing to do is definitely see a doctor, and get the appropriate investigations. But while that is happening, doctors should be giving you medication if that's something that you want to reduce that blood loss. And there's non-hormonal options. The non-hormonal options are something we call tranexamic acid, and that stops the blood from clotting. That's actually quite effective in reducing blood loss. Anti-inflammatories are also shown to reduce blood loss, and they also help with the pain. You can take the two of them together. They're most effective to start a day or two before your period, and you continue them for about 3 days during your cycle. The hormonal options are, and the first line for all heavy menstrual bleeding is the IUD, and that is 95% effective at 12 months in reducing heavy menstrual bleeding. It's really effective, and it helps like keep that endometrium nice and thin. Then there are the progestin-only pill and combined oral contraceptive pill. They're actually quite effective as well. Obviously, there's side effect profiles and, preference to the patient. So that's the options to discuss with your GP on what you would feel would be best suited to your life. And for the patient to have really heavy menstrual bleeding that's affecting their quality of life, they've trialed everything, we've excluded underlying causes, that would warrant a referral to a gynecologist, for more extensive investigations and potential surgical options if that's something that the person wanted to do.
Okay, so that's covered off on bleeding, but what about pain?
So pain is subjective, right? So what might be painful for me might not be painful for you. But what we do consider normal for periods is period pain that isn't affecting your quality of life. Generally, you get the peak of the pain in the first 2 days. If you have a bit of pain, you take over-the-counter medications like paracetamol or anti-inflammatories. You're still able to go about your day. It's not impacting your work or extracurricular activities. That's normal. As soon as I am having to take days off work or, it's impacting relationships or you're just staying at home lying in bed, that's not normal.
Here's a question.
Mm-hmm.
If things are all happening around my uterus, why do I get pain in my lower back?
So we blame that all on the prostaglandins. So prostaglandins are released during menstruation, and that's what causes the smooth muscle to contract. So the uterus and the spine are in close proximity, so you get that radiation in the pain. We also, like a physiotherapist was telling me that the hormones also loosen your ligaments, which makes you more prone to like injury. So, which is really interesting.
That is interesting. Like the Western Bulldogs AFLW team have just started doing something around. So they've customized training around their players' menstrual cycles because of that very fact. And they're wondering if, a lot of their players are getting ACL injuries because of that kind of stuff too.
Yeah.
So that is really interesting.
Yeah. So it's thought maybe it's causing some like spinal instability, and that could be a cause of the back pain as well. But importantly, the back pain could also have a root cause. So you might have an underlying condition like endometriosis, fibroids, or adenomyosis, which is causing that referred pain as well. So important if it's like quite severe and doesn't feel normal, definitely see a doctor.
Like if you are throwing up from pain.
Yeah, that's not normal.
That is not normal.
Yeah.
Okay. This is something that we've been having a lot of conversations about, especially in the last couple of years, is what period products are actually healthy to use, because there's been a lot of fear around potential chemicals in things like pads and tampons, and then, menstrual cups came along. And so what realistically is healthy? Because I know some of those studies around the heavy metals that were in tampons, the research wasn't done in a way that actually those heavy metals would even make it into your body or bloodstream. So it was just a big, scary thing that wasn't really a thing. Can you give us some explanation around that?
So I think it's actually been great that this has happened, because there's not a lot of studies on tampons and pads. And
what is wild is that they didn't start using blood on those products until very recently. They've been testing them with fluids, but not actual menstrual blood.
And it's crazy. I think this spotlight has kind of forced okay, and rightly so, females have a right to know what they're inserting into their body, right?
Yeah.
And if, there's potential toxins and chemicals that could potentially cause harm later. And we don't want to be fear-mongering either. I think cost and affordability, accessibility is really important. And if you can only afford tampons and pads, that's what you're going to use. Right now, there is not enough evidence to suggest that they will cause harm. But like I said, those studies are really important. So we just kind of wait and watch. In the interim, there's like menstrual cups, there's underwear, there's this period underwear, which is fantastic.
Yeah.
I've ordered some. I'm waiting for them to arrive. I'm, excited to give them a try. I think it's important that organic doesn't always mean free of chemicals as well. So if I had any advice, it would be just to go for the fragrance-free options.
There's one in America that's been getting a lot of airplay on social media. It's like infused with menthol. Like, can you imagine the burn of a pad that has menthol on it?
Your vagina is not a flower. It doesn't need to smell a certain way. Yeah, that's crazy.
Okay, next we're going to talk about something like this is, it's a bit gross.
Yeah.
but it's a common thing for most of us.
Yeah.
Please explain to me why period poo is a thing. And if you don't get period poos, it's literally like the week before, it's like your guts go crazy and they're like just wanting to expel everything that's in there. What is happening?
I feel like it's colonoscopy prep.
It is almost 100% like colonoscopy prep. If you've done prep.
Yeah, honestly, I think they should schedule all colonoscopies for females right after the period.
Actual sense.
So basically the understanding is it all goes back to prostaglandins. So they're released, they cause the uterus to contract, they act on the smooth muscle. They also act on the smooth muscle of the bowel, so causing the bowel to contract, and then comes your period poop. Hormonal fluctuations with progesterone also play a role. So we know when progesterone is high, you're more likely to be constipated, and that's generally before your period. And then when it drops, the period poop comes.
Oh. So it's been held back for a while, and now it's like, I'm free.
And then add the contractions as well. It's all happening. And we also know that the progesterone rise before the period is like kind of what triggers that, craving for those sweet and carby foods.
Oh, so we're eating crappy foods.
You're eating crappy foods. And that's what causes those, I don't know if you get those pesky period farts that just smell. My husband knows. He'll be like, yep,
it's coming.
It's coming. So if I have general advice for females who this, is bothersome for, it's generally keep up your fluid intake. If you're losing a lot of fluids, you want to replace those electrolytes. Eat food high in fiber, fruit and vegetables. You want to avoid stimulants like coffee, processed food, chili. Try to avoid those processed foods, but if you need it, just eat it. And you'll have a pesky fart here and there. That's fine. We're all human.
We also need to be happy.
Yeah,
and sometimes
that's right.
that means chocolate.
There's also some evidence which suggests that the fluctuations in hormones affect your neurotransmitters like serotonin, the feel-good hormones. And when they're low, you want to eat bad
because I'm trying to make myself feel happy.
You eat a cheeseburger or a Big Mac and, you feel good for that little period. And then
we pay for it later.
Yeah, then we pay for it later with the pesky farts.
With the pesky farts. Fun. Can other things be impacted by your period down there? So, for example, we've had a stack of women ask us about UTIs, and many of them have said they get a UTI right after their period finishes. Could that be connected?
Yeah, so the fluctuations in the hormones, so when estrogen rises and estrogen drops, so we know when estrogen rises, you're at increased risk of thrush, and when it drops, you're at increased risk of UTIs.
Right.
Fun.
Fun roller coaster that is.
Yeah, and the hormonal shifts have massive impacts on your mood and quality of life. For people with PMS and the more severe form, PMDD, that can impact, obviously, relationships, your work, and everything around you. And we also know that the rise in prostaglandins, especially at day 2, can cause significant cramping, and that can cause you to miss like extracurricular or sporting. And the hormones also affect your temperature, right? And that temperature effect can disrupt your sleep. So there's, especially people with PMDD, they can suffer from like insomnia, and
that's rough.
And that sleep deprivation has that knock-on effect as well. So, and then the skin changes, for people who get like hormonal acne and dry skin. So yeah, it's not just all about the blood. It's got effects everywhere.
Fun.
Yeah.
Okay. Does your weight impact your period and your cycle?
It does. So definitely. So changes in your body weight, whether you're overweight or underweight, can impact your menstruation cycle. So if you're underweight or you exercise intensively, you may have an underlying eating disorder. We find that there's an estrogen deficiency, and that can cause irregular or absent periods as a result. And then we know that people that are overweight, they're more likely to have heavy menstrual bleeding, irregular periods, more likely to have underlying conditions like polycystic ovarian syndrome, and sometimes they might not ovulate at all. And that's generally because extra fat produces estrogen, which can disrupt that cycle.
I got served this article via Instagram about how PMDD, which you've mentioned a couple of times, which is like extreme PMS, that people who have been taking these new range, or not new, they've been around for a while, but they're kind of new to us, range of weight loss injectables, so GLP-1 agonists or semaglutide, that is actually been helpful for PMDD. What do we know about that?
So there's very limited evidence for that, and I would definitely not recommend it to someone who has PMDD. We have evidence for medication that we know that works. We also know that some people report increased anxiety, depression, suicidal thoughts with these medications. So, what works for 1 or 2 people might not work for the general population. We'd have to wait till proper studies are conducted. And so I would always trial the medications which have been tested and tried, and that's generally go with your doctor.
Okay, how do we now take the things that we've learned today to make sure that we're explaining to our healthcare professionals what's actually going on with us?
Some people will think that their pain is normal or their heavy flow is normal, or some people think it's not normal, and I've seen a doctor and the doctor's dismissed it. And for those females, I'm really sorry, because if you think it's not normal and it's affecting your quality of life, then it fits those definitions. I strongly encourage any person who feels that they have symptoms that aren't normal, that Gene House is a fantastic website with a lot of information, and they also have like a period diary with a symptom tracker. And for 2 cycles, I would just encourage females to like kind of plot what's happening in terms of their flow, their passing clots, the symptoms that they're feeling, and take that information to the doctor, right? Because you're like, I've plotted this, I've done the work, and write down all the questions that you have as well. The worst part is when you leave a doctor's room and you're like, crap, I had such an important question to ask. And make sure you find a GP with a special interest in women's health. You shouldn't have to suffer in silence. Get that period diary. That information is so valuable. Write down those questions. Find that appropriate GP. Yeah, and hopefully you get some answers.
Next, for today's quick consult, we're actually going to be heading into the doctor's office with our very own Dr. Mariam. We are going to get some advice on a dilemma that Elise sent in to see if we can help her with her slightly smelly problem.
The doctor will see you now, just through here to consult room 1.
First of all, seeing as this is our very first one, can you bring us into the consult room the way that you would bring a patient into the consult room?
Definitely. So I always start by saying thank you for waiting, because I'm always over time and I apologize. You've got to give every patient the time and attention they deserve, and sometimes it's within 15 minutes and sometimes it isn't. So I apologize, but I always tell them, it might be you next that needs that 20 or 30 minutes. So my patients are usually quite grateful and they're happy to wait.
So this is where you can have your health concerns heard. So if you do have something you want to ask Dr. Mariam or any expert in the health space, make sure you reach out to us. You can send us an email, well@mamamia.com.au, or you can leave a voice note. You can find a link on how to do that in our show notes. So Elise recently reached out to us to ask this question.
I don't think my vagina smells right. It has a sort of fishy smell, and when I wash it, I notice only an hour or so later it smells bad again. The other night, my girlfriend commented that it tasted different, and I was mortified. Am I just not cleaning properly? Could this be a sign that something is wrong? Do I need to see a gyno, or is a GP okay?
Elise, thank you so much. That's a really tough question to put out there into the atmosphere, so we really do appreciate you doing this. But Mariam, what should she do?
So I'd start by saying you don't need to see a specialist. Your GP should be your first port of call, and they should definitely be able to get to the bottom of it, no pun intended. So basically what we do is we gather a bit more of a history, see if she's got any other symptoms like bleeding in between her periods, any vaginal discharge, or is it just the smell? I'd want to get more of a history about her cleaning her vagina. Is she using fragrance products? Is she inserting anything into the vagina?
Yeah, because I see a lot of these around. There's wipes and douches.
Yeah, the vagina is self-cleaning. You don't need to use these products. And the fact that, there's this expectation that our vagina should smell a certain way is just absolutely stupid. And by using these things, we can disrupt the pH balance of the vagina, and it can cause infections like thrush. So I'd want to explore more of that with her and see if is she over cleaning it or inserting it, which potentially could be causing. We also want to exclude things like foreign bodies. That's a thing. Retained tampons. That happens.
Yeah, okay. I've had friends who've forgotten.
And it happens. It happens. Like females, we're busy people, You could just push a tampon in and it's pushed the other one further at the back and you've completely forgotten about it. And then you want to exclude infections like bacterial vaginosis, thrush, and STIs. So definitely first port of call is seeing a GP. They'd gather more of a history. They'll do an examination and take some swabs, and they'll do your cervical screening test. You can also do a self-collection now, guys. That's a thing. So if you're late for your cervical smear, please do it. It's so easy, the self-collection. Yeah, and depending on what I find during examination, I might commence treatment if I suspect it's bacterial vaginosis prior to the results coming, and then follow up with the results.
It'd be so hard not to overclean when there's a smell.
Yeah.
Like, because we all know the smell of our own vaginas, and sometimes it's worse at times. Like, we all know about swamp crotch after going to the gym, or there's what's referred to as cabin crotch after you've been on a long flight. It can get a little, steamy. And I've heard someone refer to it as when you go to a nightclub bathroom.
Oh, my goodness.
And it smells like hot muff. So
I love it. Oh, my goodness.
So, like, we know that at times that it can get a little bit much, and it is really tempting to then go in and, like, just do a super thorough clean. But you reckon, like, just be careful.
Yeah, so you don't need those products. Honestly, just warm water is more than enough. Like, you don't need to be aggressive. You don't need to, like, scrub and insert soaps. It will just, like, cause more harm than good. Honestly, that stuff is just marketed. And it's, in a way, unfortunately, that makes us think our vaginas need to be flowers, and they don't. You know, it's normal to have a natural odor here and there. That's, part of our body.
Elise, I hope that helped out, and maybe just pop over to your GP and get a little bit of advice.
Yes, definitely. You need to see your GP.
Yeah. Thank you so much for joining us on this very first episode of Well. Again, if you have any questions about what we discussed or any health concerns you want us to look into, please shoot us an email. It is well@mamamia.com.au, or you can leave us a voice note as well. And if you're interested in exploring these topics and more, make sure you sign up to the Well newsletter. There's a link to that in our show notes. And as always, the advice you've heard here today is general and may not suit your exact needs. So make sure you reach out to your own doctor or health specialist to get the info that is 100% right for you. And we'll see you for your appointment this time next week. Thanks, Mariam.
Bye-bye.
Well is produced by me, Claire Murphy, our group executive producer, Georgie Page, and senior producer, Sasha Tannock, with audio production by Scott Stronach and Jacob Round.
Mamamia acknowledges the traditional owners of the land we have recorded this podcast on, the Gadigal people of the Eora Nation. We pay our respects to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander cultures.
Hi, I'm obstetrician Dr. Patrick Maloney.
And I'm Bridget Maloney. We're the hosts of The Kick, the pregnancy podcast that breaks down everything you need to know about making and growing a tiny human.
We cover it all with expert information and evidence-based discussion based on our experience of running a women's clinic and being parents to 4 boys.
From morning sickness to birth plans, strange cravings to baby movements, listen to The Kick wherever you get your podcasts.